Good evening, Erev Tov, to all our friends all over the world, wherever you are. My name is Ruby Shamir, and I'm the Executive Director of the America-Israel Friendship League, AIFL, in Israel. I'm happy to host you on this webinar focusing on Schneider Children's Hospital Medical Center of Israel. The AIFL is hosting webinars on different topics twice a week. We actually have hosted already over 80 webinars since COVID started. I'm especially proud and happy to introduce you to a project very close to my heart, with which I'm involved since its inception as a member of the supporting organization, Friends of Schneiders. The Schneider Medical Center of Israel is a unique hospital of its kind. It is innovative with breakthrough research and multidisciplinary attitude. The treatment of a child and his family include developmental services, social workers, and psychologists. The hospital was recognized as one of the leading pediatric institutions in the world. One of the missions of the hospital from the beginning was to serve as a bridge for peace. Visiting there and witnessing ultra-Orthodox father sitting with a Palestinian father watching their kids is overwhelming, and it says it all. I'm happy to introduce to you today Dr. Efrat Braun-Harlev, the CEO of the hospital. Efrat, an Israeli-born and educated in Israel, started her career at Schneider, and she's back to us as the CEO. Before we start, Efrat, I just want to tell you all, please let us know where you are calling in from, and please don't hesitate to send us questions. Efrat, you're welcome to start.
Thank you very much, Ruby. I'm very excited to be here today. So good morning, good day, good evening, good night to you wherever you are in the world. It's now about 7 o'clock here at Petah Tikva, where I'm seated in my office in Schneider Children's Medical Center. And I'm very excited to give you a very personal talk about myself, my life, and my life as the CEO of Schneider. I'm going to share my presentation with you in just a second. So just let me know that you can see it. Okay. So this is my story of Above and Beyond, my personal trip of an Israeli pediatrician, who I am a pediatrician, and a medical manager. So as I was told before, maybe some of you who are too young do not know already what a postcard is. But my presentation will be about different postcards, kind of pictures that are the pictures of my life as a pediatrician and as a medical manager throughout Israel. Why Above and Beyond? Above and Beyond is because I believe that medical care is above and beyond everything, above and beyond politics, above and beyond gender or religion, above and beyond war. And we have many ways, especially in Israel, as in other places in the world, to make medicine above and beyond. So I will start my story. My story starts with myself and my family. This is my family here in this picture. This picture was taken not a very long time ago during the second wave of COVID here in Israel. These are my 4 sons and my parents. I'm an only child, but I brought up these 4 beautiful boys. 3 of them are soldiers. 1 of them is a student in the Technion University. And you can see here them keeping apart maybe 3 or 4 meters apart. We were wishing at that time that this would be the end of COVID, but it wasn't, as you probably know. We are now still facing COVID here in Israel, just like in other places of the world. But my story is really basically beginning with my family, my parents and my 4 children, who actually kind of grew up to my personal and professional ways, and are really my greatest pride of everything. So the story of my profession starts in a very special place, which is here at Schneider in the pediatric ICU. I'm a pediatric ICU physician in my profession. I grew up at this hospital. I did my specialty in pediatrics and my subspecialty in pediatric intensive care. And I was a senior intensive care physician for quite a few years in this hospital. This picture is a very, very special picture for me because it was a very special visit. The year was about 2004, and the person standing just opposite of me was the director, the general director, the CEO of Clalit HMO in Israel. Schneider being part of Clalit HMO, and he was visiting here because of a very special visit. And this very special visit was to visit this child who actually received a kidney from an organ donor. The organ donor was a young child, about 16 years of age, who was killed during a suicide bomb in Israel, and her parents decided to donate her organs to children around Israel. So this child that you see in this picture is a Bedouin child who came from the southern part of Israel. He received a kidney. A Druze child from the upper northern part of Israel received the child's heart. An ultra-Orthodox girl from Bnei Brak, here at the central part of Israel, received the other kidney. And another Jewish child from the central part of Israel received the liver. So this was quite a special event, as other events are at this special unit. And because this was such a special event, the director of Clalit came to visit. But not only that this event was a special event for the children, for us as a nation, as Israel, but it was also a personal event for me. Because over this child's bed, we started a conversation. And I was telling Mr. Vorbrand my dilemmas being a senior physician in a pediatric ICU, having 12 children of my own at this ICU, and having my 4 children at home, as you've seen at the last slide. And my dilemmas were, how can I cope as a full-timer in such a unit, and what can we do better in our system? So he called me to have another conversation at his office, which I really didn't understand at the time how important this conversation would be for me. And actually this picture was a life changer for me, because at that time I decided that I should spend my time being both a medical director and a medical doctor. And today, in the next postcards, I will show you my dilemmas and the things that I think make us so special. So until now, I told you my story. I will tell you a little bit about the Israeli story. I think that maybe you might have heard our President Rivlin speech when he talked about the 4 tribes. The 4 tribes of Israel, which are also the Israeli hope. The 4 tribes of Israel consist, as Rivlin said, of the Jewish secular Jews tribe, the nationalist Orthodox tribe, the ultra-Orthodox tribe, and the Arab tribe. So these are 4 tribes that live in Israel, as President Rivlin said, that do not meet enough. We do not meet at all in the military. We hardly meet enough at the academy. We do not meet enough at industry. We have different educational systems for those 4 tribes. But thinking about it, what he didn't mention in his speech is that there is one place in Israel where we do meet at all times. All these 4 tribes meet together every day at the healthcare system. And in our hospital, we see children coming from all 4 tribes, or many more tribes that are in Israel, all sharing the same basic common denominator, the denominator of health. So Israel is a very young country. Almost 1/3 of its population is under 14 years of age, meaning that being a pediatric center in Israel has a lot of meaning for the Israeli population. So this postcard is about the story of Schneider, Schneider's medical center, the place where I live and work, the place of my life. So we are now celebrating 30 years of age. The hospital is called Schneider after the family of Schneider, Irving and Helen Schneider, who decided over 30 years ago, about 35 years ago or even more, to build a pediatric center in Israel. At the time, everyone thought that they were absolutely crazy. Why do we need a pediatric hospital in such a small place like Israel? They met with Professor Danon, who was the first CEO of Schneider, and together they've convinced the general administration of Clalit to build a pediatric hospital. This decision wasn't only to make a 7-story building, the building that you see at the upper part of this picture, but it was also a decision that changed the healthcare system in Israel completely when talking about pediatric care. It changed the way that we think about pediatric care. It changed the way that we work with the pediatric population and their parents. And it was a very important time for Israeli pediatric medicine. So Mr. Irving Schneider and his wife Helen not only changed pediatric care in Israel, but also have made important contact with different places, especially in the US, different medical centers in the US. The first one was the Long Island Medical Center for Children, who was actually also called Schneider Children's Medical Center at the time. And this is the first place where we learned how to do a different pediatric medical center in Israel. Since then, our center has many more collaborations with Boston Children's, with CHOP, with Cincinnati, Chicago, New York Presbyterian, and many other large centers in the US and in other places in the world, which are very, very important to us. But more important than that is that these relationships have made us a better place today. And at the lower part of this picture, what you can see is not only that we have a 7-story building that is already 30 years old and is full of great medicine that we're doing here, we are actually now building our new building that will double the size of Schneider. And now nobody is asking questions anymore. Why do you need a pediatric medical center? So really, why are we here? We are here because we believe that we are a model for others in Israel and others in places around us. We don't only treat the child, we treat the family, and we do not treat the disease, we treat the child. So we see the child, we speak the children's language. And when I say that we speak the children's language, from what I've told you in the first slide, the children's language is not just Hebrew, Arabic, Amharic, Russian, and so on and so on. It's also, how do you really speak to a 3-year-old? How do you speak to a 5-year-old? How do you explain to such a child what he's going to go through? And how do you keep him or her optimistic and live a full life even though they're in a hospital? So if I emphasize my credo, this is not just another hospital. We consider ourselves to be a hospital with policies that are made especially for children and for their families. We are looking for innovations and research that will improve the knowledge and the treatment for all the children that come to this center. We look at humanity and we look at compassion in a way that will fit the children and their families that come to our center. So within my postcards, I want to tell you a few stories that are really above and beyond. The first story is, why are we above and beyond war? The very young child that you see in this picture underwent a very complicated heart surgery a few years back. This was at 2014, just during the Gaza war, which was called Protective Edge. At that time, while missiles were shot just around our hospital and around different areas in Israel, especially the Gaza Strip, can you really imagine that a Hamas ambulance reached the Gaza border, opened up its backside, and took down this very young patient, moved him into an Israeli ambulance, a Magen David ambulance, and that ambulance, while there are sirens up in the air, brought this child to Schneider in order for us to fix this child's heart. So I believe that what you can see in this picture is a very small baby, maybe 4 kilos or so. So many medical instruments around him, probably weighing 400 kilos or so. But there is one very special thing that is missing in this picture, as you can probably see. There is no mother and there is no father. And this is not because this child doesn't have a mother or father, of course, but because this is such a complicated place that children are above and beyond war. So even though at that time his mother and father could not come to Israel, and it took us a few days to bring them over the border while there is a war going on, one would say it's not right to treat the enemy. The other would say this is the right thing to treat a child of the enemy in order to start a talk just with his parents, to start a talk with the caregiver at the Gaza Strip, at the hospital there. And we do have many relationships with a lot of the physicians at the Gaza Strip who are trying to do better medicine for the patients at their hospitals, especially when talking about the pediatrics. The next postcard that I want you to look at is this postcard, Above and Beyond Religion. This picture was taken at our ICU. You can see in this picture 2 babies, just about the same age. One is an ultra-Orthodox baby whose father is this ultra-Orthodox Jew sitting at the chair. The other is an ultra-Orthodox baby, a Muslim baby, whose mother, as you can see, is standing up there. But the interesting thing is to see, and you can see it in this picture, that they're talking one to another. So we have this very basic common denominator that is called the health of a child. The health of a child does not mean that someone is different from another one just because of their religion. So the health of a Jewish child is just the same at the time as the health of a Muslim child. And this brings on to the very basic of people just talking to one another. Would you imagine that these two people would ever talk to one another in a different place than our pediatric hospital? Never ever would they even say hello to each other. And this conversation that starts in our medical center here at Petah Tikva is one that we believe is part of our job as Israeli physicians, part of our jobs as pediatrics, to leverage it. How can we leverage it so that this conversation will not only start and happen during such a terrible time when they have their ill children? One good example of that is an organization that I also belong to, and I volunteer at, which is Ichud Hatzala organization. I think that some of you probably also know it at the US. And Ichud Hatzala organization, which I belong to, have decided to leverage exactly that. And they have many places throughout Israel, the Druze up at the north, some Arab villages in the central part of Israel, as in the southern part of Israel, and of course secular settlements and secular places in the Judean Samaron, at the central part of Israel, in Tel Aviv, in Haifa, and wherever, where ultra-Orthodox Jews, secular Jews, and Arabs work together as volunteers in order to do better health. So we have many possibilities in our healthcare system which are way above and beyond religion. This postcard is from a very different place, both in my life and in Israel. So about 2 years ago, between the year of 2017 and 2019, I was the medical director of the Northern District of Israel, of the Clalit HMO in Israel. The Northern District of Israel is from the upper side at the north, where the Druze villages are in the Golan Heights, going down until about Beit She'an, and in the middle, Tiberias and Tzfat, and many, many different villages from very many different cultures. I think that you can see in these two pictures, the meaning of different cultures in the healthcare in the community. I've learned many things through this period of my life about the northern part of Israel, but also about different cultures. One very basic thing that I've understood at this time is that just as it is important for us at a pediatric hospital to speak the language of children, it is very important for us as medical caregivers in Israel to understand different cultures, because different cultures are influenced by our medicine, and medicine might influence culture, and sometimes not in a good way. So one very important example of that is taking care of diabetes of different populations in different cultures. This was the first time in my life that I understood how important it is that when you have a community clinic in a Druze village, or when you have a community clinic in an ultra-Orthodox neighborhood in Tiberias, even though you are treating the same disease, being diabetes, you are treating it in very different cultures, so you actually need to speak in a different medical language in order to achieve good diabetic care. It's very interesting that people that are working within the healthcare system in Israel, and you can see in this picture 2 pharmacists, one who is a Druze pharmacist and the other who is an ultra-Orthodox pharmacist. They, even though that they come from a different culture, because they both work in Tiberias, they could teach me how to speak to different people coming from different cultures in order to treat diabetes better. So not only that the people that we treat are from different cultures, but also the people that work within the healthcare system who come from different cultures can make these changes of giving better healthcare. In the next few slides, I will actually tell you a story, but also tell you my dream above and beyond peace. So the story of this little girl, as many other stories started on one Friday evening when I was receiving a phone call from our orthopedic surgeon at Schneider. He received a phone call from Gaza, from his colleague at Gaza, telling him that there was a young girl, this girl that you see here at the picture, that was hurt in her one of her legs. Her blood vessels were tremendously hurt, and they brought her into a hospital at Gaza, into the operating room. They were starting to operate on her, and they thought that they were losing her leg. So they asked to move her to Schneider. Schneider is about an hour and a half away from the Gaza border. And he asked my permission to bring her to Schneider. And I said, yes, of course. He said, okay, but this is a Friday evening. How are we going to open the border in order for this girl to come? And I said, you know, I know this officer. I will call him and see whether we can bring the child over. So I called Officer Moti Almoz, who you see in this picture, which was the head of the IDF civil administration at that time. And I said, Moti, this is the story. Can you please help me? He said, of course, we will open the border and the child will be at the hospital in about an hour and a half. And there she was. So they took her into the operating room, and then about an hour later calls me that same surgeon again and tells me that the leg looks very bad and he will probably need to amputate the leg. And I said, well, do what you need to do. He said, no, I'm not going to amputate this leg unless you bring the child's father so that I can talk to him. This is a 3-year-old child. Amputation is not something that you do every day for this kind of children. And the only person that was with her was her grandmother, who was allowed to come into Israel. So I said, well, you know, it's a Friday evening. How can I do that? He said, you brought the child, now bring her dad. So I called up Moti again, said, listen, I really need her dad to come. He said, so what's the problem? I said, well, you know what's the problem. He can't cross the border. He said, look, if I can do relationship with agriculture and relationships with sports and relationship about building roads, I can have a relationship with someone that will allow this father to come into Israel, and I will make it happen on the Israeli side. He will be at the hospital within an hour. So I didn't believe it, but there he was at the hospital within an hour. And then the surgeon spoke with him and said, look, the foot looks very bad. I think we will have to amputate it. And the father, who is also in this picture, said, do what you need to do. And so they went back into the operating room. They gave her some injections, so when the amputation is done, the leg the amputation area will not hurt her once she's woken up. And when they did that, the leg suddenly looked just a little better, just a little better. So they decided to wait and not to amputate. This picture that you see here was taken about 3 months later. So she was hospitalized at Schneider for 3 months. She underwent many operations on this leg. but the leg was fine. So even though her father was with her for 3 months at our hospital, her leg was saved. I'm telling you this story and I'm showing you this picture, not just because of the story of this child, but because this child started a process of my thoughts of what should we do in order to have a partnership, a true partnership with the Palestinian Authority, sadly not with the Gaza area, but with the Judea and Samaria area, in order to make a better care for the pediatric population of Judea and Samaria. I was very happy to have Moti Almos as my partner of the IDF to help me. And another partner that you can see in this picture was at that time the head of the healthcare system at Judea and Samaria. So this picture is called Above and Beyond Nablus, and it is because this is the postcard from Nablus. So I did a fast forward from the last picture that you saw. A few months went by, and I arrived to this hospital, the Rafidia Hospital at Nablus, to explain and to show my vision to the team at the Rafidia Hospital. So you see here the head nurse, the CEO of the hospital, and other people from the Nablus area. And I offered them to have a partnership, a collaboration between Schneider Children's Medical Center and the Rafidia Hospital. And within this collaboration, to have a long-withstanding effort in order for this hospital to be able to treat some of the things that we are treating today at Schneider, and for some teams to come over to Schneider and to build up a better medical care for the pediatric population of the Palestinian Authority. So after this great...
Can I interrupt you for a second? And this has to do with the Palestinian patients. We were asked how many Palestinian and how often do you get Palestinian patients to the hospital?
The potential is very high. And if you will hear in just a few words the end of this story, and I will be happy to answer it in just a few minutes, if that's okay with you.
Sure.
Okay? Okay. So this is the Nablus story. And the other postcard from the other side, from Petah Tikva, where I'm located now, happened just about a month later. The people that you see in this picture are actually some of that team that came over from Nablus, surgeons, nurses, technicians, pediatricians. We all met for a day to talk professionally about our dreams, about our plans of how we can do things together in order for some of the pediatric patients to receive their care here at Schneider, being a tertiary care center, but for patients, for children and for their parents, not to stay here for months and months, but to be here for a short period of time and then to be transported back to the hospital at the Palestinian Authority and to continue receiving their healthcare there. So this was a great day, but after this day, we could not continue because of some political issues. So I made a great effort in many ways that are too long to tell you right now. But my next meeting and this next postcard is from Ramallah. So you can see here Mr. Abu Mazen at the Mukata in Ramallah. And this is me, much younger and pretty happy at the time. And this was because even though it was just at the middle of Ramadan and I didn't even get a drink of water, not to say any other sweets of Ramallah, I felt as if I was in a dream. I spoke to Mr. Abu Mazen, and just next to him sat Dr. Saeb Barikat, who just passed away recently from Corona. And I told them my vision and received a great opportunity to do that with the Palestinian Authority. Mr. Abu Mazen at the time told me, listen, this is a great idea. Your contact will be Mr. Saeb Barikat. And I actually was feeling as if I was just going to bring the peace treaty. It was such a great feeling. But sadly enough, that did not happen again. And I was stuck again with many issues that withheld us from having that opportunity. This was a few years back. And at that time, I left my prior position here at Schneider, being the deputy to the CEO, went, as I said, up to the north. And now that I'm back here at Schneider, I believe that there are new horizons with new partners and new initiatives. And I'm really not holding back this initiative at all. And really, really hoping that this will be able to happen once again. So really a short epilogue of the different postcards that I've shown you. I think that Irving and Helen Schneider's dream and vision really came together to displace Schneider, because it brought not only the 4 tribes of Israel and the above and beyond treatment to any child here in Israel and children that are coming from areas around us. And I've shown you today only a few of these pictures, a few of these initiatives, and a few of those postcards. But really our mission is today, 30 years later, to change the pediatric care and healthcare not only in Israel, but with our partners from other places in the world, our partners from countries around us in the Middle East, and now even farther in places like the United Emirates, to create much and more partnerships and initiatives, and to make Israel a better place, because I think that from our very basic common denominator of making children healthier, happier, and their families to understand that this is what we really want to do, is to do the above and beyond. When you look at the things that were written 30 years ago, or even more than that, at the cornerstone scroll, which you see here on this page, I think that it is very similar today, even 30 years later, that we are really dedicated to give better care to all children that come into our hospital, not only better care, better health, and a better life. Thank you very much. I really hope to hear from all of you, from some of you, and we hope that you would consider to be our partners in small ways, in large ways. We hope to see you here when you come and visit in Israel, to show you face to face and not just Zoom to Zoom what we do here. Thank you very much.
Thank you, Efrat. That was great. We got a few questions while you were talking. The first one was regarding your story, fascinating story, with the relationship both with Gaza and the Palestinian Authority in the West Bank. How many patients, I mean Palestinian patients, either from Gaza or the West Bank, do you get every year?
So this really differentiates according to the political situation. The pictures that I've shown you are from about 4, 5, 6 years ago. At that time, we used to receive patients almost on a weekly basis. Some of them who came from the Gaza Strip, I would say probably 3 or 4 per week. and some of them who came from the area of the Judea and Cimarron. It is much easier for patients to come from the Judea and Cimarron area because they can go back and forth much easier. From the Gaza Strip, it is much more complicated because they cannot really cross the border that easy way. I am sad that the potential is much, much higher than what we do see here, and that is mainly because of economical issues that have to do between the Palestinian Authority and a hospital like ours. This is exactly the kind of initiative that I'm trying to fulfill in order for them to be able to pay us less than they usually do. But for us, because we are definitely not philanthropes in that matter, and we need to receive patients and still stand economically well. So we are trying to have a third party in order for this to happen, because we know that the possibilities of the Palestinian Authority are very low. And so many of the children that need tertiary care, let's say organ transplantations or large surgeries, oncology, cardiac surgery, will go abroad to places like Turkey, Jordan, or Egypt, which is very sad because it's a much farther place. And I truly believe that we are also giving better medicine and they can be at home, which is one of the most important things as we see it, for them to be at home as quickly as possible.
Another question regarding our area is, was Schneider Hospital getting patients during the civil war in Syria, when Israel had a hospital, a temporal hospital in Quneitra? Did Schneider got children from there?
Yes, we did, but very little. Most of the patients stayed up at the north. We did receive just a few patients, a few pediatric patients, but most of them stayed up at the north.
I see. Okay, now getting to another area of the world, if you can elaborate a bit about the cooperation of Schneider Hospital with US hospitals or anywhere else in the world. We were asked specifically if you have collaboration with the Children's Hospital in Denver, Colorado.
No, actually, I don't recall sending anyone there ever.
No, not even sending, but a research collaboration or...
No, I do not recall any collaboration. That doesn't mean we do not have any, but the collaborations that we usually have in different fields are either short-term or long-term fellowships of our staff going to different places, short-term for a few months, long-term for 2-3 years, and of course research collaborations with the larger centers of the US, multi-center studies, especially in the area of oncology, endocrinology, gastroenterology, and so on, the areas where there are children with chronic disease, severe diseases that need treatment. So we are usually parts of these large international studies.
Okay, thank you. Another question is regarding COVID. Yeah. How does the hospital function during COVID? Is telemedia used to treat patients during, and how do you function during the pandemic?
So Schneider is a 270 bed hospital. We are very, very happy and hopeful that it will continue this way, that there are hardly any pediatric patients suffering directly from COVID-19. This is one of the big questions why that is. We have some thoughts about that, but still we are ready at all times and we are following at all times to make sure that there are no patients who are suffering directly from COVID. Still, as you know, a lot of children are COVID positive. This does not mean that they're suffering from COVID, but it means that they are infectious of COVID. So we do have quite a few patients that suffer from other conditions, oncology patients, transplant patients, and so on, or just trauma patients, that we actually screen all the children that come into the hospital for COVID because they are asymptomatic. And so we receive them, we treat them as if they were COVID patients, because we have to make sure that they do not transfer their COVID positive to the staff or to other patients. But we're very happy that they're not COVID. Their illness is not COVID. We did have 3 pediatric patients that were post-COVID very ill. One of them was even on an ECMO machine, an extracorporeal membrane oxygenator, because his heart collapsed as a post-COVID patient. And we were very happy to discharge him home disease-free after about a week of being on ECMO.
Now, regarding the psychological aspects of COVID, do you encounter cases of trauma or abnormal behavior of kids that get to the hospital because of COVID?
Yes, so just today I've had a long conversation with our psychiatrist, with Dr. Fenig, who is our head of the psychiatry. And she has told me what we see for the past few months, especially the last few months, not at the beginning, that there are many, many more children with eating disorders. Yes, anorexia and so on. And the thought is that because the children are not in any structured place, they do not go to school, they don't meet with other friends, and they need some sort of a structure or, a daily routine. So some kids actually develop eating disorder because this becomes their daily routine. And this is a very sad thing. So I think that when we talk about the illness of COVID that is not COVID, especially in children, we are actually mostly talking about the mental status of some children. So eating disorders is just one of them, but we know that there are many children who are really in some sort of a depressive state, feeling very alone at home, not talking to very many people, and we are very, very worried about that. So we have some programs for these children, and you have asked me before about video conferencing and telemedicine. We are actually now doing about 30% of our psychiatric care via telemedicine, with children, with their parents, and sometimes with community caregivers, in order to try and get to as many children as we can.
By the way, do you have support, talking about psychological issues, to your staff, to the staff of the hospital during this trying period?
So, I feel very blessed to be at a pediatric hospital, because just as the whole world, so is our team under stress. And we do have, of course, some help for them. But I feel blessed because I know that we are just a pediatric hospital at this time. So we have a neighboring, very large hospital, the Beilinson Hospital, the adult hospital, which is on our campus, also an Clalit HMO hospital. They're having many, many patients, severe patients, older patients with COVID, and we know how their teams cope during this year. So actually, not only that we are giving our staff some help, our staff is actually helping at Beilinson. So, for example, staff that knows how to work in ECMO goes to help there with ECMO patients, adult patients. Another interesting thing is that we've just had 2 women on an ECMO who were giving birth to their children by a cesarean section because they were so ill. So we have the neonates here, the premature babies here of those COVID patients. So we are actually sending pictures to the families, having them connect to the babies as this optimistic view of the COVID catastrophe of such a family.
Thank you, Efrat. Last question. Tell us, what are you mostly proud from your team?
Wow, what a question. I'll tell you, I think that there are probably many healthcare workers on this webinar, but I'm proud to be an Israeli healthcare worker. And I think that I'm mostly proud of the team because it's such a diverse team of Israelis, and yet they bring the diversity to its maximal, optimal point of view. You hear about such great problems of Israeli politics and such great problems of Israeli interrelationships within Israel and with outside places. This is something that you do not find when you come to a hospital. It's like a bubble of hope. And this is the thing that I'm most proud of.
Thank you, Efrat. I got another question after the last one. Can I ask that?
Of course.
Okay. So does Schneider have a outreach to the community to clinics outside of the hospital?
Yes, we do. We have Schneider at the community. Again, one of our strengths is that we belong to Clalit HMO. Clalit HMO is actually the second largest in the world after Kaiser Permanente at the US. That is because we have about 4.5 million customers of Clalit, insurees of Clalit. And because we are part of Clalit, it's very easy for us and for our teams to outreach for these community clinics from up at the north until down at the south. So we send our physicians and some other staff to those clinics for subspecialties that they might need at different clinics. And I think that we give, for that reason, very good medicine also at the community clinics.
Thank you. Thank you, Efrat. It was a great presentation.
Thank you very much.
I loved your postcards, doing it through your postcards, through your personal life. It was really great. And I think we brought the atmosphere of Schneider Children's Hospital to our audience. I thank you all for joining today. As I said at the beginning, AFL is doing twice a week webinars. And next Sunday, I would like to invite you for a webinar on chocolatiers. And this is going to be because we are for Valentine's Day, celebrating Valentine's Day with chocolate. So thank you everybody for joining. It was great having you. It was a great topic with a great presenter. Thank you very much, and see you on Sunday with chocolates. I don't know if it's not forbidden, Efrat.
It's not forbidden at all. Send some to me too, and please come and visit. Bring chocolate with you.
Okay, thank you very much. Next time when I come to the hospital, I'll bring some chocolate. Thank you very much, everybody. It was great having you. Bye-bye.
Bye-bye.